name's Jo. I'm from a CPAP therapist from CPAP Victoria. I understand that you will want to know a little bit about obstructive sleep apnea and why CPAP might be the right therapy for you. Firstly, obstructive sleep apnea is a condition where it affects the upper airway. So we have a flexible tube in the upper airway that allows us to swallow and has allowed us to evolve and speak. But because it's flexible, it also puts us a little bit at risk when we fall asleep. So when we fall asleep, the airway softens and can collapse. And in obstructive sleep apnea, there's either complete collapses happening or partial collapses. When this happens, your body is really protective and it basically wakes you up to breathe. So you'll get a signal from the brain, arousing you from sleep, the airway opens up beautifully. But this is all something that is usually undetected because it doesn't necessarily arouse you fully. It does interrupt your sleep though, and these repetitive pauses in your sleep can lead to fragmentation of sleep and a lack of good quality sleep, which is why you may experience waking up with varying different symptoms for different people. And things like morning headaches can be present. You may feel tired when you wake up, or you may feel sleepy throughout the daytime. People do present with different problems. However, if you don't have symptoms and you still have other health issues, your doctor may still have recommended the therapy in order to be a little bit protective of your health. Okay, now in terms of the treatment with CPAP therapy, it's actually a very effective form of treatment for obstructive sleep apnea. It's purely a small machine, which is very quiet these days. All the modern ones are lovely and quiet. And what happens when you turn a CPAP machine on is it actually draws the air, the room air in through a filter in the device. It spins it around in the motor and delivers it through the mask to you under pressure. So basically, it's pressurised room air that is actually splinting the upper airway open, enabling you to do the normal work of breathing. But with CPAP, it feels different to breathing with normal room air. Essentially, just breathing in the room, especially breathing out, it's a very relaxed and passive part of our breathing, where our respiratory muscles just relax and the air is expelled. But once you're on the CPAP machine, we need to make sure that your upper airway is supported, whether you breathe in or out. So there needs to be a constant inflow of air coming through the device to make sure your airway remains supported. So initially, you may experience feeling, it's difficult to breathe out. And that's quite a natural feeling when you're first starting off on CPAP therapy. Basically, you're trying to exhale against an incoming pressure force. The thing is, the more you use it, it actually starts to feel much more normal and you won't necessarily experience that. In the beginning, you may, first of all, notice it more and secondly, feel like you need to make more of an effort. Some things that you can do to sort of assist with desensitizing yourself to that is to sit in front of the TV, initially with your mask on and your machine on, and just distracting yourself, either reading a book or watching TV, and allow the machine to run while you just practice breathing and getting used to that feeling of the pressured air. We tend to use humidifiers in our CPAP machine, which is adding water to the device. The water is vaporized and the air is warmed also. So basically the air coming to you is pressurized, moisturized and warmed, just like our nose would normally do. That tends to make therapy more comfortable for most people and also minimize the side effects of CPAP, things like drying out of the nose or throat, blocking of the nose, and dry mouth as well. So that's why we use the humidifiers. Throughout your trial, we will be in contact with you to enable us to see how you're going, checking along, and also to provide you with support and guidance and advice as to what we might be able to modify or change to enable you to settle into therapy more comfortably. We will be contacting you either via phone support or perhaps via a video link with FaceTime, things like that, in order for us to be able to assist you. If you do have any questions or concerns, though, you're welcome to give the clinics a call or send us an email, and we will be in touch to follow up with you. Thank you. You'll have now taken home your CPAP machine, and you'll find helpful hints and tips in the video links that we provide. Your machines are going to start recording information when you use them, and it will send it through to us and provide us with indications of how your therapy is going. We long-term aim for your use to be all night, every night. That is the long-term goal for good treatment. However, if you're struggling and finding it difficult in the early days, then if you can aim in the short term for at least 4 hours of treatment per night, that will give us a good indication of how your therapy is going, and also provide, hopefully, you with some gains towards symptomatic relief as well. Continue to the next video, and it will show you how to set up and manage your device.